Hello everyone, once again welcome to my Oet channel. Today I came with another one informative role play card. This scenario is happening in hospital ward and you are talking to a patient. So we will see the scenario first, then we will go to one by one task. So your patient is 20 years old and is recovering following an appendectomy earlier today. So underline that earlier today because you have to start with good morning because good morning or even with good afternoon, it's okay, fine, because the surgery has finished in the morning. That due to ruptured appendix, he or she had a cannula inserted to administer antibiotics to treat an infection, that is a peritonitis. The cannula has tissued, is no longer working. So you see him or her to replace it and to do clinical observation. So from this paragraph, you came to know that this patient got admitted following an appendectomy, and the cannula is already tissued, it's not working, and now you went to the patient to replace it and to do clinical observation. So you have to procedure to carry out with the patient. Now, the one thing I have to tell you that for all hospitalized patient, please ask patient's name during 3 minutes preparation time and write it over the paper itself. Example, in this scenario, we can assume that patient's name is John. Then you can see the first task. Explain reason for seeing patient. That means it's like a new scenario. You are entering into the room and you are greeting the patient, and you have to self-introduce and you can start conversation. So that is the scenario is going on. So what is the thing you have to explain? Replacing cannula due to tissue, clinical observation. Find out how patient is feeling about the pain, fatigue, nausea. So they have given two subtasks. So how we can start? Good morning, Mr. John. Then wait for the greeting back. Okay, after patient's greet back, you can continue. I am Rashmi Rajan, one of the registered nurses working in this hospital ward. I am the in-charge nurse for you today, or I'm the one taking care of you today. Actually, I came here to replace your cannula because it is tissued and it's not working well as for clinical observation. Before proceeding further, may I know how you are feeling now? Do you have any pain, fatigue, or any nausea? So that is the first task. Togetherly, you can ask. Then the answer will be, yes, I'm fine, sister, but still I have pain over the surgical dressing. And I'm feeling tired, but not nauseated or anything else. Then the answer will be, thank you, Mr. John, for your information. And I can reassure you that this pain is normal. So our second task is reassure about the pain. It's a normal, temporary. Give information about the pain relief already administered, time needed for full effect, etc. Often to speak to doctor about additional pain relief. So we have three tasks here, subtask here. You can do like that. We can tell like this. Okay, Mr. John, thank you for information. And I would like to reassure you that regarding your pain, it is a normal after surgery. And I can tell you that it is temporary one. With the pain relieving measures, it can be relieved. And I can tell you that we have already administered you the pain medication before 1 hour, but it will take time for its full effect. So please wait for that effect. Of course, you will get benefit, but even after 1 hour, if you are not getting any relief, please notify me, and I will talk with your doctor about additional pain relief. How does that sound? Like that we can ask. And the next task will be stress doctor to visit after patient is settled on ward and clinical observation, because we need to give details of operation and recovery. Explain need to replace the cannula before doctor's visit. Current cannula is not working. Need to continue treatment of infection with antibiotics and maintain hydration. So here we are explaining something because a patient had asked something and we are giving the answer. Assume the question, okay, or else you can ask, how does that sound? We asked. So the patient's answer will be, yes, sister. I think you probably need some extra. Actually, I need some extra pain relief. So it would be grateful if you could speak to the doctor without any delay now itself. And I'm thinking that when doctor will come and examine me, and he can prescribe any strong painkillers for me, it will be a relief for my pain. Then we can reassure the patient with these reasonings and all, because first we need to do the recannulation, and we have to check the vital signs, then only we can inform the doctor. So how we can state it? Mr. John, I can truly understand your concern, but no need to worry. And really, I want to tell you that the doctor, of course, the doctor will visit you without any delay, but it is mandatory for me to do your clinical observation and replace cannula before doctor's visit, because when he will come here, actually he will, of course, he will ask me about your clinical observation, that is a vital signs and all. So if you allow me to do the recannulation and the clinical observation, it will be beneficial to produce the report in front of doctor. Moreover, I would like to tell you that the current cannula is not working anymore, and for preventing you from infection, doctor has prescribed some antibiotics, and as well as your hydration also will be provided through this cannulation only. So it is very much important for you to have this recannulation without any delay. Are you getting my point, Mr. John? So like that, you can give all information togetherly. The patient's answer will be, yes, sister, I can understand. Then you can ask, do you have any more doubts or any concern? The question will be, could you please explain me why this cannula got issued? Then we can explain, give reason for tissuing of cannula like accumulation of fluid, patient moving around, the veins fragile. Find out any other patient concern. We can answer that. Yes, your questions are reasonable. I can answer for that. Maybe the tissuing of cannula can be maybe because of many reasons, such as accumulation of fluid over there, and maybe you are moving around the bed, so sometime by mistakenly also the cannula can be displaced, and sometimes the veins will be very fragile after surgery. So these are the possible reason for tissuing. And do you want me to explain anything more? Like that we can ask. So this question should not be repeated. If you ask one time, you can ask, do you have any other concern? Otherwise you can ask, is it okay for you? And is there anything to be clarified? Is there anything to be explained? Am I clear? Is it clear? How does that sound? Like that, many connective sentences are there. You can just write it down in a cardboard and keep it with you always when you will practice the role play card. When you finish 10 or 15 cards, it will be by heart for you. So you can use without the paper also. Don't repeat any connective sentences. Then the next task will be, emphasize the advantage of delivering antibiotics through cannula, direct to bloodstream, faster acting, more effective for infection. Explain when patient is likely to be changed to oral medication in few days. Establish patient's consent to you to replace cannula and to do clinical observation. Actually, they have given many subtasks. So how you can handle all these questions? We already asked, do you have anything to be clarified? The patient's question will be, could you please tell me, sister, is it necessary for recannulation? I can suggest you that I can take the antibiotic in the tablet form. So is it okay? Then the answer will be, Mr. John, I can truly understand your feelings. I know that you're feeling that the cannulation will be painful, but I can tell you the advantage of this cannulation, because the antibiotics are prescribed as injection form, and if we are injecting through intravenously, that means through the cannula, it will directly goes into the bloodstream very fast, and the action also will be more effective than oral tablet. And regarding the oral medication, no need to worry. After a few days, your doctor will change the intravenous route to oral route. Once you will settle down without any infection, you can continue with the oral tablet as per doctor's consultation. Are you getting my point? Like that, we can ask in between. Then the next thing will be, do you have any more concern? The patient's answer will be, no, sister, I don't have any more concerns. Okay, fine. Then we can tell that, okay, Mr. John, I hope I have clarified all your doubts. If you don't have any other question, may I proceed with replacement of cannula and your clinical observation? So that is established patient's consent. Okay, you have to ask in that way. If you don't have any other question, may I proceed with your replacement of cannula and clinical observation with your consent? That's enough. Okay. Then the answer will be yes, of course you can. Then we can tell thank you. So that is the winding up of this role play card. So this is second role play card. Actually, it is pretty much bigger. So you can expect in second role play. In this, the important thing is time management. You have to be enough fast to include every points within 5 minutes. So what you have to do, always practice with someone, like your friends, colleagues, or your workmates, or somewhere you will have some OET friends, or even with your husbands or wife, or with your children. You can do the role play cards as much as possible. How much you can do, just practice it, then only the flow of sentences will come, or else you will be stuck over there. You will search for the next sentence, so it will give you a bad presentation and it will affect your mark. So I hope this role play card is beneficial for you. Practice well and you can make speaking very easy. So we will see with another one informative video. Until then, bye, take care.